is a continuing improvement process.
Is this the same time frame, John, 4 p.m. or what's the time?
Well, we didn't set the time of day, but you all are here at 4 p.m., so I might propose that. Does that work for you, Joel?
Yeah, I think we need to nail down the time.
Yeah.
He's in trouble.
That's right. He'll listen.
No, he's asking the right question.
You have so far to go.
Yeah.
Is 4 o'clock a
Well,
good
the
time?
bridge is closed. I have to go
Yeah,
to
the bridge is closed, we all the way around.
Is 4 p.m. a good time?
Yes. Yes, fine.
Okay. So our intent would be for July 10 to have 3 things on the agenda, basically. I think we would start with a discussion on criteria, which you all started, quite frankly. I mean, we'll have to come up with some criteria data-wise, and at this point it'll be draft. We'll have a couple of weeks to think about it before we buckle it down on the 24th and we start writing the draft report. But the criteria would be the first item on the agenda. What you all produced in terms of your perceived needs would be the second piece of the agenda, and the third piece would be an update from Dr. Baird and Nishikant regarding the indicators that have come out of the other assessments and the capacity. So that would be summary information. Am I sticking to what we talked about, Dr. Baird?
Yep.
And I will comment, it is aggressive, so we'll try to keep at it.
We copied a list of people with email addresses.
Get it out to
Send
people?
them out to them.
Yes.
Including those who are able to participate but weren't able to be here today.
Yes, they're on our list. We have, Josh, we've got this sign up and we've got a list. We're gonna crosswalk, first let me ask, did everybody sign this sign-in sheet? I see nods, nobody did, okay. We're gonna crosswalk this with the information that we've got, and we're gonna correct because we know you were here giving us this, and use this as the information that we keep in our files. And then the idea would be, as long as you all don't object, we'll do as the officer has suggested and circulate this. Is everybody okay with that? Okay, one of the benefits here, potentially, that I hope will come from this process, is you all get to know each other, start having dialogues that I unfortunately had to shut off every now and then, and I'm going to try to play that role appropriately as best I can. But if you all can connect with each other in productive ways, that's an ancillary benefit.
I just want to add that the 3 health departments have taken the lead in this, but I think the key word is community. And though it is going to be to our benefit, there's no question, but this is a document that we hope that PhD is going to use, that enforcement's going to use, academia is going to use, mental health's going to use, anybody that deals with that. And this should be a document we can look at with pride, not for just the health department, for all of us in the community. And I know the hospital, I think you guys have to do an improvement plan every 4 years or something for IRS and things, and hopefully this will help you guys too, and then we'll help each other.
Anybody have thoughts? We have a 5th item on the agenda, which is as available, but it is 10 till 6. So I don't know, does anybody have any further comment they want to make about this issue of criteria for substantiation or perceptions regarding health needs in general?
Is one of your resources actually contacting insurance carriers to see reported zip codes and code utilizations in our area? Would that be something we might want to address?
I mean, if that's a piece of data that you feel that would really help facilitate planning among any of the social service agencies, then maybe that's a system that we talk about putting in place. In Summit County, we've had some conversations with at least the major Medicaid providers, or payers, I should say, in order to start tracking some of those things. So it's something that we could look at here as well.
I'm going to just interject, because I think that's an excellent comment. That's the kind of thing we need to be thinking about in terms of setting up data collection systems over time. But I also want to point out, it's been an assumption underlying this work that the first cut what we're doing is gonna be based on what we've got, rather than building new systems to bring it in. This is an ambitious time frame, but it's built on the assumption that we're gonna use what we've got for this. And good ideas, like the one Dr. Drummond just outlined, becomes a part of what we can do in the future.
So for our homework, do you want us to bring, it says for us to list our 3 to 5 most important health needs, and what we interpret as the most important health needs. So if I brought in data like that as part of what, to substantiate, that would be.
Well, you don't have to,
Perfect.
you don't have to substantiate it, I mean, you don't have to go do a bunch of analysis to say that my health need, what I think is a health need is substantiated.
Right.
He's just asking if you have some
Right.
evidence to provide it.
But you're putting your finger on something, Dr. Drummond, that I do want to emphasize, because I'm glad you're raising this. The homework we hope you will do, every one of you here, to the extent is, send us, and we've got Josh Villa's email as the place to send it. Send us what you think are the 3 to 5 largest needs. If you go through this process, nobody's going to be right or wrong. We're trying to get perceptions here, and we may come back together, and you may change your mind after we go through that process. And quite frankly, that's fine. We're all going to learn through this process. But we do want to see, what's your perception? Because if you all come back with 3 or 4 of the same things, and we got 0 data on that, well, then that says something, and we may find that's the case. And the second thing I want to point out, Dr. Drummond, because I know you've got a clinic you're operating here, and you've got some data that may be readily available at your disposal. What we are asking of you is to give us the evidence as best you got it. We're not telling you like Dr. Baird saying, go do a big research project, but if you've got it, put it in writing, and it becomes a part of what is available just to create a substantiation of a need. Now, what we may substantiate as a need this summer, as this system gets better, hopefully over time, our definition of a well-substantiated need, maybe 10 years from now, isn't the same as what it is right now. But you gotta start someplace.
However, correct me if I'm wrong, but you don't necessarily have to have data to propose that as a need.
Correct.
So,
Correct.
you could say, just simply in my expertise, in the field I've been working in law enforcement, I have seen a huge increase in the number of deaths due to opiates. I think, that would be evidence. It
Yes,
doesn't
it is.
necessarily have to say last year there was 3 and this year there's 8 or.
But if you've got 3 and 8, or if you got some numbers, that helps. Because what we'd like to be able to say at the end of this process is, not only did we look at the data, but we went to people who are looking at it, and they gave us the best information they have. And we put it in one place, and then we'll look at how do we improve that body of knowledge over time. And so I really appreciate your comment, Dr. Drummond, because a number of you may have data right at your fingertips that can help a lot at this stage, even if you think it's crap.
One question though, is we have needs that I think are still high needs, but they're being met, I think. For example, we need crisis services for people that are suicidal. I think we have good services for that, but it's still a high need. If that went away, we'd have a lot more deaths because of that. Then of course there's other needs that really, they're just gaping holes. They're not met, they're unmet needs kind of thing. So, as I'm looking at this, like, how would I answer that kind of thing? So, I guess it's partly, maybe it's a capacity question, are the needs being met versus things that are still.
The way I am interpreting this, and I'm going to let Dr. Baird weigh in here too, because I think you're asking a very good question. I am thinking unmet needs, but if there are needs that are being met through existing systems, it's important to know that. So I don't know, do you have a remark on this?
I was just kind of thinking, and again, chime in, if you were given $1 million and you have to spend it on this community and improving health, what 5 things would you tackle?
That's a good way to frame it.
So would you put a bunch of money into a system that's already, you feel, serving an existing and taking care of that need? Maybe you want to amp it up. Or maybe you want to put that money somewhere else.
Couldn't it also be that those services might go away later on, so we want to make sure we continue as you suggested, so maybe that would be.
Sustainability.
That's sort of where we are as a
Yeah.
system, is, we got a little extra money this past year, it's probably gonna go away, and we have to start making priority decisions. It's like, which needs, do we just have to absolutely meet, even though we feel we're meeting them now, and which.
So maybe you frame it as sustain it.
Right, sustainable.
I don't think we should, it shouldn't be meet needs that we think are met already. I think that Joel may feel that's met, Sue may feel it's not met. And I think that we don't want to take away from it, not that I think you guys do, but I think we need to put the needs, and again, that this goes for money to come in the future and everything else. Let's put the 5 needs that we feel are most important. And plus the document where, as a health department or somebody's going to steer this, that could be, when we get to our improvement plan, we may not have to worry about that, cross that off our list, but let's wait till we get to that point before we cross it off.
Is it, Joel, did we clarify the question?
Yeah, I like Heather's idea about thinking if we have additional money coming in for what we already have and something, where would I allocate that? It's a good
If
perspective.
you know it's going away, say the need is to sustain the services
Right.
as they exist.
Thanks. Good comment.
Do people feel like they can send Josh an email with this by the end of next week? Between the end of next week and July 10, we'll try to put what you've given us in some understandable form.
Are you gonna send a reminder email?
We can do that.
When you send us the names, just say, by the way.
By the way,
Send it to.
don't forget your homework.
Sorry.
Josh, can we work that out?
It can be done.
Where's Michigan?
It can be done.
You got that down?
Yeah.
Thank you. Any other comments? I would just close by saying thank you to all of you for the excellent dialogue. After sitting here for 2 hours, I'm pretty convinced we got the right people, and I thank you for your efforts. And thank you also to the 3 health departments for